Made
Yes, I'm just gonna move my video back because all
Hi.
of a sudden we're looking at like, and using very literally a Harry Potter
Yes.
puzzle box as my stand. There we go. Maybe, I think. Cool. All right. I've got all
It's
sorts of
working
stuff
well.
around. Yeah. You're joined. Yeah. You're joined. This is Claire's introduction to Instagram Live. So, Joy, welcome. So,
Thank
we
you.
are here
Good
to
to be
talk to you guys a
here.
little bit. Is there a delay?
A little bit. I have a kind of a spotty connection.
Okay. Pause and then. So we are here tonight to talk to you guys a little bit about things that you can be doing during self-isolation. I can't talk apparently today, specifically for your pelvic floor. And this is a bit of a continuation of the talk from last night. Last night I was talking with the founders of Hello Again, and we're going to start doing some pelvic floor tips for relaxation for at home, self-management of things, kind of carrying on with that conversation, but we just ran out of time because we had awesome questions. So we decided to kind of carry this over tonight. And then I was able to have Claire come. And Claire, if you could tell us a little bit about yourself, that'd be awesome.
Sure. So I went to school in Atlanta at Mercer University. I am a doctor of physical therapy, and I specialize in pelvic floor as well as concussion management, with a specific passion for pelvic floor and helping both men and women and anyone in between to find their function and find their joy. And I think one thing that really drew me to the pelvic floor specifically was how impactful it is in our lives and how ignored it feels in healthcare. So it's something that I'm super passionate about bringing more awareness to, as well as helping others learn and discover for themselves how their pelvic floor really affects their own lives and how they can really optimize that, just like we do in any other kind of PT.
That is great. And that's a perfect segue. So we as pelvic health physical therapists have both feel strongly that everyone should know about this muscle group called the pelvic floor. And so what I'm going to do here is I'm going to tell you guys a little bit about just kind of where to find the pelvic floor, because a lot of people don't even know what the heck we're talking about. And even if you do a little bit of basic anatomy, never has hurt anybody. So we're going to go through a little basic anatomy. And then I'm going to ask Clara to tell us a little bit more about pelvic floor function, why we should care about this thing, because, sometimes we just don't really know that we should care about something until we figure that out. So that being said, I brought my handy little pelvic floor model here home. Okay. So this is the pelvis, and we're looking at this from the front view. So if you're looking in the mirror, you're looking at yourself this way for orientation. Okay. These bones here where we say we're putting our hands on our hips, okay, when we turn this around, this is our tailbone, the lowest part of our spine, and this is the low part of our low back vertebrae, our lumbar vertebrae. And this bony ring is the pelvis, okay? Now inside of that thing, we have musculature, and outside we do. So our pelvic floor is really about 3 layers of muscles. So if I flip us this way, and this is a female model, okay, female anatomy model, we are looking basically at the base of the pelvic floor as we're looking in between your legs, okay? So when we've got here, we have your urethral meatus, so this is where urine comes out of. We have our vaginal canal, and we have our anal sphincter, anal canal down here. We have all of this stuff. Everything that's red is muscular. So this is our most superficial layer of the pelvic floor. We have a middle layer also, but then our deepest layer we'll see kind of on the inside here. I'm sorry, I'm going to cover my own face with the pelvis. But down in that, you see that inner bowl of muscles. And if we can kind of appreciate how these connect onto the sides, that inner layer of that pelvic floor and these layers of these pelvic floor muscles actually connect out to the hamstring area and out to our hips. So this functions to be inside this pelvic ring, but also integrates pelvis and hip functioning. Claire, if you could tell us a little bit about the functions of this muscle group, that would be awesome. And tell us a little bit about why we care about whether this muscle group can both contract and relax. Because we talk about contractions a lot in social media, but we
Yeah.
don't talk a lot about relaxation.
Right. Yes. So the pelvic floor's role is ultimately support. So the pelvic floor is there as kind of like this hammock or sling to help support our pelvic organs. So men and women both have pelvic organs. We have bladders, we have the rectum and the colon, but then we also have, in women, the uterus and the ovaries, and in men, they have their prostate. So that's what the pelvic floor's primary role is to provide more support to those organs, but then also it has sphincteral functions. So that's our bowel and bladder control. And then also it has sexual functions. So if those muscles aren't working, you're not having orgasms, you don't have sensation, we need sexual functions. And then it's also part of our postural control mechanism and load shift or load transfer from the lower body to the upper body and vice versa. And then it also plays a role in our breathing and our intra-abdominal pressure system, which we also need to have a good pressure system for good postural support. Through all movements, holding weights, lifting weight, remaining upright, anything that requires movement, we need the pelvic floor to be involved. It's important to be able to contract the pelvic floor because that's where our muscle is functioning. That's where we're stopping the flow of urine. We're maybe pushing a bowel movement. We need to be able to contract those muscles, but we also need to be able to relax them so that we're not straining with a bowel movement, so that we're able to relax those muscles so that urine can exit. And then we also need to be able to relax them just for that pressure system. So it's really important that the muscles aren't on all the time. So if you think about any other muscle in the body. So bicep is right here. So we'll talk about that real quick. If our bicep, we wanted to strengthen it, we're not walking around just holding it like this. It's not going to function super well like this. This is a super tight muscle and it's not a functional one. We need to be able to lengthen all the way to also contract all the way. So without that ability to relax completely, we're not able to access the muscle or use it the way that it's meant to be used, which is through this full range of motion.
Cool. And so in terms of that relaxation, if we are obviously we're contracting, we're going to be lifting up and kind of holding everything up and in. When we relax that musculature, that's something that's really important because that helps us, just like any other tight muscle group, to actually relax musculature, get more blood circulation in there, better nerve function. And we need things like that because that helps us with pain regulation also, right? Like if we have really tight muscles, that's going to lead to potential pelvic pain issues. And that's something that a lot of people don't realize is that this whole thing is muscular. So if you imagine this is like a big muscular area, you can get knots in there, just like you get like in your upper trap or and how that might not make things feel that awesome, which is going to talk is going to kind of lead into our next topic of pelvic pain issues. And this is one of the things that we treat in a clinic really often, all age ranges. Okay, so this can happen in teenage years, overtraining. You might have a teenage daughter saying that like it hurts down there and it's uncomfortable with like yoga pants, like tight pants. You can have that with pregnancy, postpartum, and then as we get older with perimenopause and menopause, which was kind of part of what we were talking about last night. Claire, can you tell us a little bit about your experience with pelvic pain issues and kind of some of the normal things you see in the clinic?
Yeah, absolutely. So typically in the presence of pelvic pain, it's very rare that I find completely healthy muscles, right? Typically there's a muscle, if not many muscles that are very tight. We find tender points or trigger points in those muscles, and those can refer pain all over the place. And it also affects the muscle's ability to function. So we're not able to accurately recruit those muscles that have those trigger points in them. So a lot of what we do is kind of focus on relaxing those, but also I find people with kind of postural deviations. So a lot of the time, they sit with their shoulders kind of forward and their hips tucked, and that puts a lot of pressure through the pelvic floor as well. And then also tight muscles surrounding it, so around the hip and in the core, we find a lot of tight muscles. And that I would say is pretty consistent across the board. There's some kind of tightness or dysfunction somewhere that we really have to address through not only stretching, but strengthening. So a tight muscle is typically a weak one. So we want to make sure that it's strong too.
That's great. And that's something that is really great for people to know is that by doing core muscle strengthening and whatnot at home, and we can work on home strengthening stuff, that's something we can be doing right now. What people don't realize is like that aside from just doing our exercises, like our strengthening and our stretching exercises, or maybe like home group yoga, a lot of people don't realize that aspects of what we do in the clinic to help with muscular relaxation that are more manual based therapies that require like human interaction, there are some of these things that we can do at home. And that's something we're going to show you guys some tools for here in a few minutes. Some other things that people don't realize is contributing to this pelvic pain issue is that your central nervous system, that upregulation and downregulation can really have a lot to do with tension of our tissues and our whole body systemically and also our pelvic floor. And in this time of kind of fear and uncertainty, a lot of people are finding that they're kind of more snappy and a little bit short-tempered. I know that my boyfriend's told me at least once in this last couple of weeks that I have not been being so kind, and I had to profusely apologize. But this kind of constant upregulation, what I mean by this is that our nervous systems are like kind of maxed out right now, you know, with all the scary news, all of the bad stuff. And what people don't realize is that we're walking around here with a really full kind of canister load of stress, which is like different than usually maybe our normal, what might be a little bit lower. You know, you've got work, kids, finances, but we don't usually have work, kids, finances, and then coronavirus, you know, bringing us up to like an 8 out of 10 sort of a level here. So if you imagine that if we're really in that heightened state, we might be walking around with like this postural tension because we're stiff and nervous all the time. And this postural tension that a lot of times we see in the neck or the back, that can translate directly to our diaphragm, so our big breathing muscle, and to our pelvic floor. And so one of the things we're going to teach you guys here today is we're each going to teach you an exercise that's kind of one of our favorite kind of down regulation exercises. So you can be working on decreasing systemic stress. If you're able to decrease your systemic stress, then all of your muscle tension, including that pelvic floor tension, will go down. The other thing we're going to teach you here in a minute is each of us is going to teach you one of our favorite pelvic floor relaxation exercises. So we're going to teach you one thing each that's going to bring you down a notch. We're each going to teach you another thing that's going to help you to relax that pelvic floor. And this is not stretching per se, it's relaxation. So it's more kind of like the meditation and just kind of mental, physical body connection kind of a deal. Then we're going to talk to you guys a minute about like a couple of our favorite tools for home for managing stress and managing pelvic floor pain so that we can cover those and you guys can have some more ideas of things that you can be doing for self-care right now and really helping yourself along so you're not just sitting at home kind of wondering when you can get back into pelvic floor PT and wishing that you had help now. So with that being said, Claire, do you want to take us through your favorite CNS downregulating exercise or one of your favorites?
I would love to. Okay, so I'm going to take the phone. All right. My favorite actually happens to be sort of a pelvic floor relaxation one as well. Don't worry, I have another one in my exercise bank, but this is probably my favorite of all time. So basically, I'm laying here and then I'm going to kind of like rotate the phone, but basically, I'm here and my legs, the soles of my feet are together. Am I upside down for y'all?
Yeah, but that's
Heidi.
okay.
Okay. Well, I'm laying down. My legs are elevated on my couch. Maybe it'll help if I do this. And
There we
I'm
go.
just,
Much better.
okay, great. So I like to place one hand on my abdomen here, and then the other one on my chest, and then keeping my legs elevated and letting gravity assist my knees to fall down like that. And then I do 5-5-5. So what a 5-5-5 breathing is deep breathing into the belly. You can see how big I could make it. Very big. Okay, so you make your belly as big as possible, breathing in for 5 seconds, and then you hold for a nice five. I'm kind of exhaling as I talk, and then you exhale for five. So you one of those slow, controlled exhales, almost like you're trying to fog a mirror, like a but through the nose. So closing the glottis. And that helps to control the breathing. But this is a really lovely way to relax the pelvic floor, relax the legs, and facilitate some blood flow going down from the ankles back to your heart and improve circulation as well as, chill, lay down, enjoy, spend some time on the floor. It's great.
I'm 100% waiting for the cat to come up and attack your face.
I think I locked her in a room.
Oh,
She's been interrupting too
like
many
I've
of
just
my
been
home health
waiting
or
for her to
my
like walk in.
telemedicine stuff.
Nice. I love the animal sidekicks like during everyone's home talks. Well, my favorite CNS exercise is actually also breathwork based. Shocker. This one is purely a breathwork based activity though, and I learned this from my friend Kimmy Moss. And Kimmy and I are actually going to do a talk next week specifically about breathwork, downregulation, and how this can help bolster our immune system next week. This exercise is called a take five. Take five because we have 5 fingers on our hands. And this is something kind of cool that this is a tactile, meaning a touch-based thing that you can literally take with you anywhere. So you can do this in the car if you're stuck in traffic, if you're, God forbid, in the doctor's office waiting for a test right now, if you are doing anything. And we have a lot of pregnant mamas and mamas to be. This is a really nice exercise to do to just kind of help to calm ourselves down during this whole time. So what we're going to do here is you're going to take one hand, whichever is your preference, and you're going to just put it in a place where you can touch it, okay? Other hand, we're going to use one of our fingers. And what we're going to do here is we are going to inhale, tracing from the crease of our wrist down one finger, and then we are going to exhale twice as slowly coming back down, okay, to the crease. And I'm literally tracing to give myself something to focus on as I do this. We're going to try to do this all nasal breathing, meaning we're going to breathe in and out through our nose, okay, to keep things slow, keep things super chill. So we're going to try the best we can to close our mouths and use our nose only, okay? So I'm going to talk us through the first couple. So finger on the palm at the wrist crease. We're going to breathe in, exhale twice as slowly. Preferably through the nose. Now we're going to go up the next finger. So we're going to go up the ring finger and a half speed. Now we're going to go up the index finger. Exhale, half speed. Up the pointer finger. Exhale, half speed. Finally up the thumb. Exhale, half speed. Now the great thing about this is you can repeat that take 5 as many times as you need. So if you get to the thumb and you're still feeling a little too amped up, go ahead and go back to your fingertip. And you can always go back and forth. This is also a really great thing to teach your kids who might be running around like feral animals. Natalie, I'm talking to you, girl. Around their houses and being nutso. So little kids, easy thing to teach them, okay? So take 5 is one of my favorite down regulation techniques. So passing it back to Claire, could you take us through one of your favorite pelvic floor relaxation exercises?
Sure. So I think my absolute favorite is okay, y'all are gonna find a theme. My favorite things are whenever I'm lying down on my back. It's just my favorite thing in the world. Um, so we're gonna do it again. So some of you might go to yoga. Um, and if you do, this is a probably a familiar exercise, modified though. So this is called half happy baby. But basically, let's see if I can set us up for this one. What do you think? This is okay.
That's totally fine.
Hi, Violet. Okay, so half happy baby, I keep one leg bent, and then I like to grab behind the knee on the opposite leg and draw it towards my armpit and just relax here. So the goal is not to feel a pelvic floor stretch here. You shouldn't feel any stress at all. It's just a nice way to go into this gravity lesson position for the pelvic floor and let it relax into a slightly more lengthened position. So spending a nice amount of time here can be really, really lovely. And then switching sides whenever you feel, okay, I'm really relaxed on that side, same thing on the other. But really, while you do this, focusing on that deep breathing, sending air down into the pelvic floor. If you think about your perineum, try and lengthen through that or push air to the perineum and just hold your leg towards the armpit, just like that. And it should feel nice. It should be a relaxing pose.
I like that one, and I'm 100% doing it as soon as I'm not on video. I'm like, yes. P.S. I'm in my pajamas. In case anyone hasn't noticed yet, you'll be seeing my furry slippers in like 5 seconds. So cool. Thank you for that. All right, I'm going to tell you guys a little bit about one of my favorite pelvic floor exercises, and this is actually for the diaphragm. And Claire's shown us a couple really awesome things that involve the pelvic floor, and so I'm going to show its kind of sister act, which is the diaphragm. And so our diaphragm sits right here, okay? Our pelvic floor sits right down here. And if we imagine when you're breathing in, this has to be able to drop, and then our pelvic floor drops. And then if our pelvic floor comes up, diaphragm comes up. So this kind of works like these bellows, like this pumping mechanism. Well, if this thing is super tight and tense, it can actually create more downward force and pressure into the pelvic floor. So I'm going to show you a ball that I use in the clinic, and this is like not a paid endorsement, okay? I'm going to want to throw that out there before someone freaks out about it, but I just think this is a really great product. But I'm also going to show you with a home hack of something you could potentially use instead of. So this is called a Yamuna ball, okay? And there's other brands of these, but they're lovely because they're firm enough that you can lay on them, but soft enough it doesn't like hurt your bones, okay? You don't have one of these, no problem. You can order them online, but if you have something else, this is a dog toy, people, okay? It's a chuck it, all right? It isn't even totally perfectly round, but it'll do the job, okay? So you don't have this, don't feel like you have to wait for Amazon to bring it to you. Use something around the house. You could use a softball. You could use like a kid's plastic play ball from like the local CVS pharmacy or Rite Aid. You can use whatever you want. So don't feel like it has to be this, okay? But something relatively this size, which is like bigger than a softball, but smaller than a soccer ball would be great. If you don't have that, use what you've got. Use a soccer ball. You can maybe mildly deflate it a little bit. Worst case scenario, use a foam roll. It'll be a little rough, but like you can totally get the job done. So I'm going to turn sideways here. Here are the furry slippers. Okay. So what I'm going to do here is I'm going to place this ball directly underneath my diaphragm, my low rib. Okay. I'm going to lay down on this, and I'm getting this so it's diaphragm. Okay. Now, this is not something that you're like, oh gosh, this is immediately super pleasant. Claire gave you something really nice. This isn't like really that nice. Okay. And what I'm going to do here from here is I'm going to try to do this one-handed is I'm going to roll side to side on my diaphragm on this ball, and you can see the ball's deforming, but I'm using this to provide a diaphragmatic release. If you find one spot, whoop, hold on, I just lost Claire. So bear with me as I lay on the floor, and let me see if I can join her back up. I'm just gonna make faces in the camera for just a minute here. Hold, please. There you are. I'm just making faces, waiting for you to come back.
I
Okay.
made
So I have
it.
been now mobilizing my diaphragm for a hot minute. Okay. And after you've mobilized your diaphragm, feel free to take this ball. I've been going side to side here. Feel free to take the ball, and you can take this guy. I'm going to see if I can show you here without my camera falling. And you can then roll one side of your abdominal muscles going up and down. Okay. Could do the exact same thing where I put this on the other side of my abs. My navel's here, so now I'm on the right side. Same thing, rolling up and down. Okay. Then if you want to get super crazy, put this down below your belly button, so right in the front of your pubic bone. And then you can take this and you can roll side to side. Okay, you can see it a little bit better when I roll away from the camera. But by doing this, we're using our ball, our foam roller, our toy to do this release for this anterior wall and upper wall of our musculature to help to provide less downward pressure to that pelvic floor.
I love it. I love that so much.
That was a workout. That was like, felt hard right. That felt hard right now. Like COVID out of shape. Like, dear Lord. Okay, so continuing this on, let's talk about something that I know is a really important to you topic to you, Claire, which is normalization of talking about sex and sex ed and talking about women's pleasure. And in that, with that being said, I know that both of us have brought a couple of our favorite toys to help to reintroduce intimacy to oneself. And I want to talk about that a little bit and what we mean by that. And also, if we're talking about pelvic pain and we're talking about how like we might have pain up into the vaginal canal, sometimes the idea of penetration, whether that's with a sex toy or with a partner, is kind of a really scary, almost taboo feeling topic, induces anxiety in people who have pelvic pain. So we want to show you a couple each of our favorite toys that don't involve penetration, that you can use just external only, and also talk to you about a couple of therapeutic tools that you could be using for some stretching and soft tissue work on your own during self-quarantine. So Claire, if you want to show us your toys first and kind of talk a little bit about them, that would be delightful. And then we'll let you show and tell like first grade. But
Oh my God, I love it. So fun.
like
Okay.
yeah,
Adult
sex ed.
show and tell. Okay.
Mm-hmm.
So the first one I want to show everyone is something called the Womanizer by We Vibe. Okay.
Awesome name.
This it's fantastic. What I love about it is so basically it's a vibrator, but it's also meant for clitoral stimulation as well. But it's extremely gentle. It uses pulse air technology. But what's great is that whenever you turn it on, which I'll do that. So it's on and nothing's happening. Nothing happens until it senses touch. And then it actually activates. So let's say you're someone who deals with pelvic pain or tissue sensitivity, and you don't, maybe it gets too intense or it's too much or you need a break. The moment you lift, it stops. And same with it eases into that sensation as well, which I think is fantastic. So the moment you lift off, it stops whatever it's doing. Whether it's pulsing or it's vibrating or it's both. So I really love it. I think it's fantastic. It's very quiet. Like I turned it on, you couldn't hear anything.
Nope.
So I think it's great. I mean, it's on and it's doing something and you can't tell. So I think that's great too. And then if sometimes let's say that this were too intense or if somebody doesn't like the more targeted sensation. The other item I was going to show off is actually, it's by the same company, We Vibe, but this is called Touch. So this is it. And so this one I like, it's still a vibrator and it still for external use. You could use it internally too, but it's great for external use. And it's super, super soft, super smooth, and really gentle vibration. It goes higher if you'd like it, but I think it's a really nice alternative if you want something that's maybe more off to the side or something that's less direct to those very sensitive areas. So
Sure.
this is a good option too.
I feel like we almost brought the exact same things. Which, I mean, it shows that they're good stuff. It's good stuff,
Yeah,
right? Just different companies,
absolutely.
but like, you know, it's great that like, you know, there's kind of a universal feeling about this situation. So these two toys, I'll show them in the same order. This guy, okay, is an external. It has, again, the clitoral suction, okay, and it's by a brand called Lilo. And if you see how wide this thing is, okay, part of the idea with this is that if you are to kind of press this up against the vaginal area, is that this will actually be helping to touch other parts of the clitoral tissue as well as just right at the normal tip that we all think of here. Um, I'll post a picture of clitoral anatomy after this talk, but what a lot of people don't realize is how big it is. Okay, like this is usually something we hear dudes talking about, but like your clitoral tissue is not just like the little like nodule that we see that sticks out. Okay, it is like a big organ. All right, and it's important to know this because a lot of people are super sensitive right at like the external piece. Okay, but realize that we've got these other pieces like these legs that come down underneath your vulva. And so we can be using these parts to actually stimulate that as well and kind of spread the stimulation out. So it's very similar to what Claire was saying is that sometimes it's like this is too much, but we can use other parts. This also has this other rounded side. So again, you can use this for other types of stimulation and all external. Okay. This one, like I said, is this, it's a brand that's called the Lilo. And I'll give the website for this. There's a website brand that, or a website that does curation of sex toys that I really like called enticeme.com. And I'll put up a link to that page as well. But enticeme.com, one of the cool things about this particular curation is everything that is on that web page is sourced to be only made of materials that are not harmful. And something we were talking about last night was about how absorbent the vaginal tissue is and how so many products actually have things in them that are harmful for us to be absorbing through the vaginal tissue, whether we're talking about a tampon, a sex toy, lubricant, whatever. And so everything that's on this website, and one of the reasons, like I said, I really like it, is everything is specifically curated to be non-toxic. The other toy that I brought, very similar and to what Claire was showing, is a thing called a toy called the Mimi Soft. It's a really soft touch, soft, squishy handheld massager. So for a lot of people who maybe are nervous about down there intimacy, they may feel like they could do something with massage and doing kind of more like sensual massage and self-care. And that's something that I recommend to patients and friends often is like, you know what? Things down here don't feel like you want to be touched, but maybe you can kind of start working your way into that intimacy by doing other things like massaging lotion all over your body or dry brushing, or maybe using a toy like this that is very non-threatening. It almost looks like a bar of soap, and you can use this for really nice self-massage. Then if you feel like it, then you can start trying to kind of like work your way down to the vaginal area. But I really like this for that kind of a purpose. So that being said, with that show and tell, let's talk about dilators. And Claire, I have a dilator set here. If you want to talk a little bit about these bad boys, I'll play Vanna White and like show them, and then you can kind
Okay.
of talk about these. Talk about these if that works for you, because you
Yeah.
clearly know what these are too.
So dilators, I feel like men, women, do not be deceived. Dilator is not an intimidating thing, and it's not about necessarily stretching tissue. It's about desensitizing tissue. The room is
Mm-hmm.
there. We want to desensitize it. We want to mobilize tissue. So do not be afraid of the word dilator. Sometimes I've heard people use the word vaginal trainer, which I really like. But we start at low levels. So there are very small ones you can see. And this kind of dilator is great because it's made out of silicone. So it's a much more
It's
comfortable,
super soft.
yes, very soft, malleable
Yeah.
material. So it's far less intimidating than that cold, hard plastic. And it
Hmm.
typically, those more medical dilators are also very heavy. So this is a really nice option or alternative.
And this
But
brand
you,
is Intimate Rose.
we love
Yeah.
them.
Yeah.
They're
I was like, I
great.
just had to double check.
Yes.
Oh.
But they're fantastic. You start at a small level or whatever size is best for your tissue tolerance. So some people have very, very sensitive perineal tissue or that external right at the vaginal entryway, that tissue. So we would start very, very, very small, very light, and work our way up. But it's a very slow process of working your way up, and it's a very
Mhm.
gentle way of doing that until you can introduce a new size. So whenever a smaller size starts to feel like, oh, nothing, and maybe just some pressure, that's when you would be ready to progress to the next one. So there is a system in place. I think some people are recommended to just use dilators without very much
Yeah.
advice, or it's just like any other training program, right? So you want to make sure you increase the load slowly and to your tolerance is the most important thing. But it's there to desensitize it, to mobilize it. So it helps with women who are maybe postpartum who had a grade 3 tear. Maybe you have a lot of scar tissue. It's a great way to mobilize that. Or maybe you just have a sensitive perineal area. Another great way to desensitize it. And then you work towards the size that you want. So if there are other objects that are entering your vaginal canal, you want to mimic that size, whatever that size may be. If you would like to go larger than that, just to be more comfortable or expand that much, then that's great too. But it's a fantastic way to desensitize and improve your tolerance and permanently help that tissue and those muscles.
And this one, like, I mean, this little pink guy, this is about the same size as my finger. So, I mean, this is smaller than like a normal tampon. So, like, for people who are like, wow, like, I'm not even sure I want to put a tampon in, this size might be for you. And then you can see that these gradually increase. So, like Claire was saying, to increase your tolerance, you can increase size. Now, this is what is this size 1 to 4 category. And then this is a set, so it's a graduated set, but there is a set that goes all the way up to an 8. So there's a second set that has sizes 5 through 8. So realize that just like any other kind of training program, you've got these different options and sizes. And so these are available from Intimate Rose. And this is just, like we said, a really nice one because it's so soft and malleable. Now, Intimate Rose has another tool that helps to mimic at home what we do in physical therapy with doing internal muscular releases or trigger point work. And so this little guy, if you want to talk to us a little bit about what this dude is, it looks like a little snake, which is called a pelvic
Yes,
wand. And I'll show the box so people
pelvic
can see
wands.
the pelvic
They're a
wand.
godsend. They're amazing. I wish every woman would buy one and have one and use it because it's fantastic. So, recommend if you do want one and maybe you do have pelvic floor dysfunction, you see a professional first so that you can learn how to use it.
That would be
It's
ideal.
possible to apply too much pressure. Yes, exactly. However, in this time, it's a great tool to replace kind of that manual aspect to hold you over until you can see a pelvic floor specialist. But what's great is so the end on the bottom that Heidi is holding, that is the end that almost mimics like a therapist's finger or thumb. And it's one that you can insert vaginally and then you can press it slightly down, you can rotate it around, and find different tissues and different muscles that might be sensitive or maybe short or tight. You may feel different sensations with a little bit of pressure. Sometimes you'll feel pulling, sometimes stinging, sometimes burning, sometimes just deep achiness. You can feel it in your back, in your stomach, sometimes in your bladder. And those are just muscle referrals from the pelvic floor. So it's very common to feel sensations other than the place that you're pressing. But with that, it's a great way to desensitize and relax the muscles. So we've been talking a lot about relaxation. It's a great tool for that. I like to kind of liken the pelvic floor to a stick of butter. Whenever we work on it, we start super, super, super light. All it takes to relax a muscle is light, light, light touch, just like a stick of butter, and it slowly starts to sink as we bring in more healthy blood flow. So that's really the idea of this pelvic wand, which is fantastic. It has another end on it. That end is great to get the deeper muscles, but I do recommend being very well versed in the shorter end first. And I would not recommend using that end unless you're under the care of a professional, just because it can potentially poke at your cervix and maybe some other tissues that we don't necessarily want to poke at. But if you did want to get deeper muscles, it's there. But it's a great handle, and it gives you a nice bit of real estate to control where that Therawand is.
Like a lot of people know what like a Theracane is for the neck, and this is like the same thing, people, but for your vagina. Okay, it's like you can use a Theracane for up here. This is your vagina Theracane. Now, something that you mentioned, Claire, and I think is a really great point, is that, obviously this talk is not meant to constitute medical advice. We have not seen you as a patient. If we have, great, but if we haven't, this doesn't constitute medical advice. If you are wanting to get one of these things that we have talked about, and you're thinking, man, I really wish I could get to use these now at home, realize that we both offer virtual sessions, okay? And you can set up the sessions easily by, if you want to direct message us at Mountain2CPT, which is MTN, the letter 2, or number 2, sorry, I need to go back to Sesame Street, the number 2, SEAPT, so MTN2SEAPT, dear Lord. But feel free to message us through that and just send us a message and say, hey, I'd like to set up a consult. We'll get you all the information that you need. And so these are tools that we can help you with virtually, which might sound really odd, but the virtual sessions right now are working really well for a lot of people in terms of getting people started with pelvic floor PT. And as we've already discussed in this talk, there's a lot that you can do at home that can get you started with these things that you don't necessarily have to be coming into a clinic right now. So since we're all trying to do our part here, we hope that you guys try some of these things. Let us know if you have questions, and if anyone wants to schedule a virtual session with us to learn more about these, we're always happy to help. Claire, is there anything else you'd like to add before we sign off, or does anyone watching have any questions for us you'd like to pick our brains at for right now?
Yes, we're open to questions.
All right, girl.
I guess other things just briefly that I'll talk about until maybe if people want to ask their questions while they're thinking of them. Considering what signs there are if you have pelvic floor dysfunction, I think sometimes we don't always know. So we assume no, right? So if you feel any amount of pelvic pain with any kind of penetration, that can include inserting tampons, gynecological exams, or sex or penetrative sex, any of those things, if you feel any amount of pain, even if it's only momentary, that is a sign of pelvic floor dysfunction. There is something happening there in the muscles. That pain is not necessarily a normal sign that we would expect in a muscle. So we would want to address that because it can persist or maybe become a bigger issue later. Pelvic floor issues cause stomach bloating. Is that true? It can be. So the pelvic floor is connected to a lot of connective tissue and is deeply integrated with our colon and our digestive system. So if there's any kind of specific tightness in the pelvic floor, it could cause tightness or pulling on the colon and block any of that gas from exiting, and maybe potentially cause an increase in that bloating or the kind of holding on to the air in the colon. And also it's related to constipation. So I've had lots and lots of patients who have come to me who have been constipated. We work with them 2 times and suddenly they have regular bowel movements every other day or every day. and then their bloating starts to decrease or minimize. There are a lot of things that we can do to address those things, not only dietary changes, nutritional changes, and supplementation, but also to the muscles. So it's definitely related. Good question, Faith.
I'm glad that you touched on that, Claire, because that was something I wanted to mention was that we hear a lot and we talk a lot about how incontinence is a sign of a pelvic floor issue. But a lot of times, again, we talk about that, but we don't talk about the constipation, which again ties into this tightness issue.
Yes, absolutely. And that's the other thing too. Like incontinence is one, or stress incontinence. So maybe we don't think of ourselves as young, healthy women, or younger, healthier women, or even older, healthy women as having incontinence. But if you sneeze and you leak a little bit, or if you're going to the bathroom more than 2 times in a night and you didn't have eight ounces of water before you went to bed, those are things that can also be addressed through pelvic floor PT. So yes, the manual therapy is a huge part of that, but other part of it is implementing different habits as well as stretches and exercises.
And then we've got a question, can we virtually help with both incontinence and constipation? And the answer is yes. We can teach you exercises that you can be doing for both of those things, as well as manual therapy techniques
Absolutely.
that you can do on yourself. So absolutely, those are some things that are really manageable virtually right now. So any other questions,
Yes,
ladies
the biggest
and
part in
gents?
managing those is education. Yeah.
Definitely. Well, we'll sign off here. And if anyone has further questions, feel free to DM us. We're more than happy to help. Like I said, if you want to schedule a virtual, please send us a message as well. We've got one last one coming in. And it says, is it normal to experience pelvic floor issues during perimenopause? Claire, you want to take this one?
Yes, absolutely. It's okay. Normal. Let's clarify normal first.
Norm
So
versus normal.
I would say it is the norm. We would expect it because your hormones are changing and they're kind of, and Heidi, y'all touched on this last night with Hello Again, that the hormones are changing pretty rapidly and they're kind of in a lot of heights and lows. And so those changes affect the vulvar and the vaginal tissue significantly, and can absolutely lead to more sensitivity and potentially tightened muscles from that sensitivity. And we can see increases in that potential stress incontinence or bowel changes or sexual changes. And typically that is hormone driven, but that doesn't mean that it cannot be resolved or addressed by treating the muscles and your function and changing your movement.
And if you ladies and gents missed the talk with Hello Again, I'm going to be posting a YouTube link up on the Instagram page here this evening. And so for every talk we do, we're going to try to videotape those. And if we're successful, which right now I'm at a 50-50 ratio on that, but the successful video recordings, hopefully tonight too, I'm going to be posting the YouTube links because the videos are too long to post to Instagram. But that way you guys can go back and rewatch anything that you missed. So, all right. Well, I'm gonna go eat some dinner and I'm gonna go finish my Topo Chico not beer. The best biz in the biz, according to my friend Travis. So I thank you everyone for joining us. It was great. Thank you, Claire. I really appreciate your input.
Thanks for having
So
me.
we'll do it again soon. Have a wonderful night.
Everybody have a great night. Thank you.